Today I'll be explaining you the basic pre-operative workup that we'll require before planning any neurosurgery procedure. Firstly, we'll be requiring all your MRI, CT and X-ray films and reports. Second, the patient should not be on any blood thinner medications. So many patients are prescribed various types of blood thinners like ecosprin, clopidogrel, apixaban, ticagrelor and many others for various conditions related to the heart or stroke or sometimes simply in combination with any cholesterol medications. So if the patient is on any blood thinner medications, they have to be stopped minimum 5 days prior to the surgery. Third, we'll be requiring your basic blood workup, blood profile, your urine examination, 2D echo and anesthesia fitness. Depending on the comorbidities the patient is having, we might require fitnesses from other specialists like cardiology, general physician, urology, endocrinology, etc. So, once all the fitnesses are taken and the patient is prepared, the patient needs to get admitted 1 day prior to surgery. During this part, we will be preparing the patient with respect to giving IV fluids, doing part preparation and monitoring of the vitals. From 12 midnight, the patient has to be completely NBM, that is nil by mouth. No food, no water. If the patient is hypertensive or hypothyroid or some other critical conditions, then they will need to take those medications with sip of water in the morning prior to the surgery. Once everything is fine, we'll be shifting the patient to pre-operative area where the anesthetist will review again and then shift the patient inside the OT. Inside the OT, the patient will be given general anesthesia and to aid in breathing, a tube will be placed down the throat into the lungs which will be connected to the ventilator support. Also, a urine pipe or a catheter will be placed to help the patient in voiding urine during the surgery as well as for some time post-operatively also. Once everything is done, the patient will be positioned according to what surgery we are doing, followed by proceeding for the surgical steps.